Team Ghanshyamnath, sir, principal sir, video is not working.
Hello.
Yes, sir. Sir, kindly on your video, sir.
Yeah, we
are on time.
Yes, sir. Okay, thank you.
Shall we start now?
Yeah, ma'am. We can start now.
Again, I request everyone to mute your audio, please, so that we can conduct the event smoothly. Please mute your audio. Everyone is requested to mute your audio, please. Okay. Good afternoon, everyone present here. I, Dr. Pallavi Sharma, Assistant Professor of Philosophy, NEF College, Guwahati, take the opportunity and honor to welcome you all to this national webinar on gender discrimination and COVID-19 issues and problems. This is organized by Faculty of Arts, NEF College, Guwahati, Assam. On behalf of the organizing committee, I welcome Dr. Zakir Hussain, Director, NEF Group of Colleges, Dr. Ghanshyam Nath, Principal, NEF College, Dr. Raja Chakraborty, Principal, NEF College of Pharmacy, Mrs. Farhana Ahmed, Assistant Director, NEF College, all the faculty members of NEF College, and all our esteemed participants who have joined us through this Zoom platform today. Am I audible?
Yes,
ma'am.
Yes, okay. Gender discrimination is not a new issue discussed in an academic platform. Still, it remains relevant for serious discussions at every stage, as we often come across certain news and experiences that take us back again to the issues where it started. Today's deliberation is particularly focused on such gender-specific experiences that experienced during this pandemic period. To discuss the matter of the webinar, today we are privileged to have among us two experts in this area of study joining us live through this Zoom platform. Today we have with us first Professor Arvinder Ansari ma'am. Presently, she is working as the head of the Department of Sociology in Jamia Millia Islamia, New Delhi. Along with her involvement in different bodies, ma'am is also working as a member of Ministry of Affairs, Government of India. She is also associated with several national and international organizations through her engagement in research activities. I welcome you, ma'am, and thank you for being with us. Ma'am will be talking on caregiving role in pandemic, gender perspective of COVID-19. Next, we have another speaker, she is Professor Polly Vacklin. She is the head of the Department of Women's Studies, Guwahati University. In her journey as an academician, she is engaged with different institutions and organizations in India and abroad. Currently, ma'am is also engaged as a mentor for the Assam Care Program of Government of Assam during the COVID-19 pandemic. I welcome you, ma'am, and thank you for being with us. Ma'am will be talking on gender and education during the pandemic period. Through this virtual platform, I welcome both of you to NEF College Guwahati. We are really glad to have you here today. Now, before starting, I am just repeating the same thing. Before starting the lecture sessions, I cordially request all the participants to mute your audio so that no unwanted sound disturbs the program. For all sorts of queries and suggestions, you please utilize the chat box. We will take note of everything. If you have any question related to the lectures, please send your question in the chat box again and mention the name of the speakers from whom you want to have the answer. because the questions will be answered after both the sessions are over. Both the lecture sessions are over. The feedback link will be sent during the question answer session. I again cordially request all the participants to cooperate in smoothly conducting the event. Thank you all. Now, without wasting much time, let us move to the inauguration of today's webinar. I now request Principal of NEF College, Dr. Ghanshyam Nath, to formally inaugurate the program and deliver his welcome address. Over to Principal, sir. Sir, you may continue. Principal, sir.
Hello.
Am I audible? Yeah, Principal, sir, please
Yes,
you
yes.
continue.
Yes. Good afternoon to all of you present in the seminar, Gender Discrimination and COVID-19 Issue and Problem, organized by Faculty of Arts, NEF College, Lokhra, Guwahati 40. NEF College is a PG institute having courses in higher secondary arts and commerce, BA, BCom, MA, MCom, including professional MBA, BBA, BCA, and MSW and BSW. Within the same campus, the Institute of Pharmacy has been started by the National Education Foundation Trust, whose chairman is Dr. Zakir Hussain. It is the noble spirit of Dr. Zakir Hussain, director of the college, to prepare the young minds and soul so that they can become the future pillar of the country. NEF College has state-of-art infrastructure and facilities, spacious classroom, well-stocked library, and aesthetically pleasing campus, besides all informed and well-experienced faculty that cater to the needs of the students. I am confident that this institute will go a long way in imparting qualification to the student in time to come, and it gives me immense pleasure to be a part of the institution. Coming to the topics of the seminar, I am very much happy that it is the best suited current topics. Gender discrimination is not a new one. Rather, it is an issue for human society since the age of Mahabharata and Ramayana. But during the pandemic situation, COVID-19, the matter of gender discrimination has become crystal clear. There are different policies and legal matters adopted by the government to provide the equal opportunity and safety to the men and women in the society, but disparities still persist. Coming to today's context, today's webinar is planned to deliberate on the gender issues during the world crisis caused by COVID-19. During the last 6 months, domestic violence have been increasing, for which women are the most sufferer. Nurses, A&M, ASA workers were being used during the COVID-19, but they were not honored properly as compared to other counterparts. You can have the idea that yesterday at Nogao in a nursing home, one doctor physically assaulted one nurse, which depicts gender discrimination in workplace. Today, our distinguished speaker will deliberate on the issue and make this platform effective in minimizing these problems of gender discrimination. With this word, I do hereby inaugurate today's webinar and welcome the speaker, Professor Arvind Ansari, Head of the Department of Sociology, Jamia Millia Islamia University, and Professor Philip Hacklin, Head of the Department of Women's Studies, Guwahati University. Once again, I welcome the participants in the seminar, and I offer my heartiest thanks to the organizer of the webinar, Faculty of Arts, College Guwahati, for their nice arrangement. Thanking you all. I conclude here. Thank you.
Thank you, sir, for your valuable speech. We look forward to organize more and more such events under your able guidance. Now I pass over to Mr. Ankur Goswami to introduce our first speaker, Professor Arvinder Ansari ma'am, and then ma'am will continue with her speech. Ankur sir, please.
Thank you, Dr. Pallavi ma'am. I feel honored as I proceed to introduce to the assembled online audience, revered Professor Arvinder Ansari. Professor Ansari started her distinguished academic career in 1998 as a lecturer in the Department of Sociology, Jamia Millia Islamia, New Delhi. And she is now professor and head in the said department of the prestigious Central University. Alongside this, she has held many administrative positions in the university, and she is a member of many professional, international, and national organizations like International Sociological Association, Canadian Sociological Association, and Indian Sociological Society. Professor Ansari had been resource person of capacity building of administrators in higher education, a program of UGC, and gender sensitization programs of MHRD. At present, she is member ICC, Ministry of Minority Affairs, Government of India. Known for her academic and research expertise, she is on panel of many prestigious institutions and organizations. Professor Ansari has had teaching and research experience of more than 2 decades now. She was awarded the PhD for her study on the impact of communal violence on women, a sociological study of Delhi and Surat riot victims by Jawaharlal Nehru University in 1997. Professor Ansari has been invited as visiting fellow at Center for Social Systems, Jawaharlal Nehru University in March 2018, and to the Department of Sociology, Kolhapur University in 2019. The core research areas of Professor Ansari are sociology of ethnicity and minority studies, sociology of gender, feminist sociology, cultural studies, sociology of globalization, focusing on issues of identity, conflict, and peace, and urban studies with special focus on spatial segregation. Some of our recent research and publications have focused on sociology of marginalization, among which one of the outstanding instances is Being a Minority in India, Issues and Challenges, published by Alter Press. She has presented papers in many international and national conferences, workshops, and symposia. She has many research projects and publications to her credit. Her completed research projects include Half Widows, Permanent Victims of Violence, Gendered Implications of Conflict in Kashmir. It was sponsored by the ICSSR. Then major research projects include Globalization and Indian Handloom Industry, a study of weavers of Varanasi district. Then major research projects also include Social Isolation of Minorities, a comparative study of Muslim location in Delhi and Meerut city, and so on and so forth. So we are indeed very pleased and delighted and honored to, and we are also blessed that such a personage of immense knowledge and vast experience and exceptional worth has so kindly acceded to be amongst us, to be a part of this webinar, to share her precious findings, observations, ideas, and counsels as she enlightens us on the topic caregiving roles in pandemic, gender perspectives of COVID-19. Over to you, Professor Arvinder Ansari, ma'am. I humbly request you to kindly deliver your speech.
Thank you, Ankur. And Ankur has scared me with setting such a tall order for me. I don't know, friends, whether I would be able to come up to your expectations, but definitely I would like to thank Dr. Ghansham, the principal, Ghansham Naji, principal of the college, Dr. Pallavi, Dr. Rinku, for bringing me to this platform. And I must also acknowledge the link between this connection is my student, Rehana Ajmera Sultana, who was working in that college. So I thank her also, introducing me to such galaxy of scholars. And welcome to this webinar rather, because this is the time. Today I would be talking about the caregiving role of women in this pandemic, and that is very important because that is something which has been never disassociated from women, and women are always looked at as caregivers. Now, how this caregiving has, kind of proved additional responsibilities for women, and how, the question which worries us as a social scientist is that the inequalities which have we had tried to negotiate these inequalities for past so many years, but now in this pandemic situation, these inequalities are again back in the forefront. And how are we going to deal with this situation post-pandemic is a very, very important question, and especially when it comes to the caregiving role of women, which is so, naturally integrated into her identity. Because if you look at the division of labor based on sex, and if we start our understanding historically, that is from primitive society, so this is the role which women have been performing, though they have made tremendous progress. I am not a pessimist who would say that women have not made a progress. Women have made a lot of progress, but this caregiving responsibility has been at the core of her roles in society. With this question, I would also like to bring your attention to that women is not a homogeneous category. Women is a heterogeneous category, and it varies across cultures, ethnicities, societies, so differently. But at the bottom of it is her role as mother and wife, as a caregiver. In all societies, she is mother, in all societies, she is wife, and in all societies, she is caregiver. And how these responsibilities have been allocated to her. Yes, one is on the basis of division of labor based on sex, but now how this pandemic situation has become a very, very important situation for her. So if we start analyzing the role of women in caregiving, we can start from inside the family, then we can go to the help available to us in the family. That is, hope I am audible, friends. Am I audible? Because my screen
yes, ma'am. Yes, ma'am.
Okay.
Yes,
Okay,
ma'am.
okay. My screen is blank, so I just got with it. So one is, the inside the house, domestic workers, caregivers, teachers. I'm just pointing few very important roles, which there are health workers, caregivers when I say health workers also. So we see with lockdown, schools have been closed down, hospitals, the entry to the hospitals has been restricted, the entry of the domestic workers have been restricted. So how this has extended the responsibilities or increased the manifold responsibilities of the women. If I start with middle class women, we all belong to middle class, so schools being closed, now it becomes the duty of the mother to sit with child and see that child is doing online classes. How child is first mother has to be digitally trained so that she can train her children in digital technology. Number one. Number two, in absence of any kind of help, if we see that there was a division of responsibility in pre-pandemic situation, you had many kind of support system. Women had created a support system for themselves so that they can balance their professional and personal role. But in pandemic, in lockdown, that support system has crashed. That also came under the restriction, and you could not have domestic health, you could not order food from outside, the norms for health and hygiene and sanitation had increased very fold. So taking care of aged, because all those have been under lockdown situations, all these entries to house are restricted. So who is responsible to manage all these are these children need food, they need good food. In the absence of market, you have to be a good food cook, you have to get good food for your children so that you take care of their nutrition health. The whole emphasis was on immunity. So I'm talking about middle class, then I come to the lower class and higher class, that is later, but I'll talk about middle class, which we all have been experiencing, and how feminist epistemology is very important to understand this. So the extension of her role as a cook, earlier she was dependent on a help market, Swiggy, Zomato, whatever, but in between for 4 months till May, all these services, so she had to learn good recipes every day so that she can take care of the taste and the health of the children. She had to be there as a tutor, teacher, because all the responsibility of seeing that her children do not suffer in lockdown was on her. She had to take care of elderly in the family because they required special care. Then what happened in this process? This is one, and she had to also manage, she had to deliver professionally. If she's working, she had to manage her professional roles with same kind of professionalism and sincerity pre-pandemic. This is one set of situation. Another set of situation is migrant or women who are working in the unorganized sector. So first question during lockdown for them was to have enough food inside the home. Standing in, even if the lockdown was announced, they had to negotiate, they had to traverse and see that there are rations. And for rations, they have to have income in their home. So whatever little resources they had, they tried to manage. Then come these domestic workers who work with us, who were thrown out, people who were asked not to come. So they did get some help in the initial time, but then they didn't get the help. And now what are the challenges for these domestic workers, the women who were there? No, they were really vulnerable, because it is evident that the increased demand of care falls on their shoulders in face with schools get closed, greater demand for healthcare, need to raise hygiene standards in home, leaving them more exposed to the virus if they are working in the household where there are patients whom they are taking care, and they cannot refuse because that is their bread and butter. Secondly, when domestic workers cannot do jobs because of social distancing, recommendations or restrictions on movement, and are uncertain whether their wages will be paid, especially those who do not have formal contract. We see that domestic workers do not have contract here. Very few are employed through agencies, rest they are, there is no contract signed. And yes, though government made a lot of announcements and people tried, but because of the limited resources, the compulsions for people to meet their demands, they could not, continuously. 1 month they thought of paying their helps without getting work done, but next month it was very difficult for them also to meet their requirements. And specific demands on the domestic workers to take, they have been prepared to take care of sick people, monitoring, administering medicines, and very important that there is no labor inspection on their roles. So these workers are exposed to demands from employers to continue work in crisis situations. There are two sets of situations. In one set of situation, yes, people did not want to come. Did not want them to come and work with them. But there was another kind of situation where these migrant women were living with the families, where they were asked to work, and they were asked to work without salary. Now, without salary, because the excuse with the employers was that because they are not getting salary, so they cannot pay the salary. And due to the quarantine situation, they could also not go back to their hometown. So imagine the plight of such workers also, and they were all women. So this is another category of women. Third category of women is health workers. We have ASHA workers, we have civil defense workers, we have women who are working in, we have nurses, and if we see the ILO statistics, it says 70% of the women are working in caregiving, in health caregiving, which is kind of the 70% of health caregivers are women in the form of nurses, midwives, guides, social defense workers, ASHA workers. And what about these women? They were and they did not have any leave. They had to go for work, they had to report for work, maintaining all the protocol of pandemic. And the kind of accessibility and resources available to them is very strange. If you would see the reports have told us that the PPE kits actually were manufactured keeping doctors in mind, and they were all, masculine in size. So women had to, the nurses, the caregivers, the healthcare workers, they had to use those PPE kits, unfitting PPE kits, which made their movement more difficult.
Ma'am? Hello, ma'am? Can you hear me?
She's muted or what?
I think she got disconnected. Hello, ma'am?
Unmuted me from there. Can you hear me?
Yeah,
Yeah,
it's
ma'am.
okay now.
So I have to go back. Where did you could not listen to me? I mean, my domestic workers point was complete.
Yeah, ma'am, that
Yes.
Where did, this disconnect happened?
PPE
So that I
kit.
can, PPE kit from there.
Yeah.
Okay, so I was talking about see the lack of vision at the part of the state. These are very important, and these are important instances which had impacted. And let me tell you, in this whole caregiving process, across cultures, across class, women had to forego their own well-being, whether it was physical well-being or mental well-being, because the pressure, the stress, due to manifold increase in their responsibilities in pandemic and lockdown, had made them vulnerable to these situations. And these are the insights, these are these are very important understandings which we need to understand. So, the reports have documented that women working in health sector are responsible for people dependent on them in households, in care industry. They must continue to go to work in addition to the responsibilities at the home, which increases their excess workload and stress. This situation has come about in regional context of persistent wage discrimination. The income of women working in health sector is 25% less than men. This is ILO's report. And the experiences of ASHA workers, which I would like to share with you, is also very important. That these ASHA care workers, because they were trained to work in community health system. So now that training which was there made them responsible for taking care, tracking COVID victims and exposing them to the infection more and more. So they had to work 24/7, but the income which they were getting was very less, and they had to negotiate with the loss of income at the household also, because males in the house had lost the jobs already, or whatever frugal income they were getting was a little support or little relief to women. Are here, that was also gone. And we know that all these ASHA workers majoritarianly come from marginalized sections, communities. If we see that majority of them are coming from the social groups which are backward. So, delay in their salaries and increasing expenses, rising expenses, debt cycles, and malnutrition had put women into a very, very stressful situations. There are a lot of casualties happening with the health workers, and we read every day, doctors, nurses, that they are being reported. But let me tell you, the casualties among ASHA workers, among civil defense workers are not being reported. And very interesting fact which comes from the field, they are also administered medicines so that they do not catch infection. But this hydrochlorine which they have been taking, the quinine medicine which is used for malaria, has a very important side effect. That side effect is that it affects your heart. So they are taking those medicines, they are being administered these medicines, but the long drawn consequences on their health are going to be bad. So we see that how they are the frontiers, they are the corona warriors who are providing us healthcare on a very, very subsidized rate, and our nation is surviving, because if you look at the healthcare policy and we see the healthcare inequalities, the stark reality which has come to notice is that the access to public healthcare is associated with class. It is very, very much associated with the class. Public healthcare facilities are not available to all the citizens of this country equally. So that is very, very painful fact. And if we see the migrant worker, women who had to walk for kilometers, pregnant women, and the food they had, whatever food, little food they had, first they tried to feed it to their family, because that their natural role as caregivers, mothers and wives or caregivers, which has been with them since hunting and food gathering society, has not changed. So In the process, they neglect their health, their well-being. So, we see that even if they are not infected by COVID, but they have multiple health issues which are coming up due to stress, high BP, diabetes, and other kind of comorbidities are developing. So, ASHA workers have been now also included into Ayushman Bharat scheme, where where they have again a lot of responsibilities. Very interestingly, which is a very different reality which has come into our notice, and this was pointed out by Professor Govind Kalekar in her one of her webinars, that there is a study done by Institute of Economic Growth, Delhi, and Chan School of Public Health in US, where they have seen that yes, the men are more vulnerable to death in corona, but surprisingly in India they have found that women are more vulnerable to corona deaths in certain age segment. In certain age group, the mortality rate of women in India due to COVID is also high, which is a very different scenario from a global scenario. So this is what is there, and again the demands. One is the demand on their domestic roles. Then also women have to meet the demands of the children, the elderly, the husband. The marital rapes have increased a lot in COVID-19 situation. How to maintain social distancing, because social distancing, physical distancing, and if a woman does not, if wife does not want to have sex, but husband can demand from her. So this also is one very important. She cannot refuse that to her under her marital obligations, is something which is also one very important reason against the violence against the women and girls. And post-COVID, the reports which have come have proved that the violence against girls and women have intensified. 30% increase in France and 25% increase in Argentina, with 33% increase in Cyprus, and in India, almost 50% increase in the violence has been reported. Now, this is something very important which we need to look at. Now, it is very important to look at why these inequalities have become more. The worry is not how do we deal these inequalities during pandemic, but this inequalities, this discrimination, the fear is that this discrimination might get consolidated in the post-pandemic situation. These inequalities will increase because we see, another very important fact, though I'm not touching upon the economic aspect of COVID-19, I'm just focusing on the health aspect of COVID-19. We have seen that women are losing jobs more in numbers than men because of COVID-19, and how they would get the public domain, the public spaces which they had claimed earlier, how they are going to claim back that public spaces is a very, very important question. Now, very important question is that why this is happening, why there is this vulnerability among women, and why this violence is justified. Why this violence is justified and why it is not also taken note of is a very important question. The answer lies in the patriarchy, the male sovereignty, the masculine policies in our country, which are there, which kind of have paid less attention to gender sensitization. Friends, you would say what she is talking, she's sounding as a radical feminist. No, friends, I would like to seek your attention to the structures of, and women are also responsible for that. I would not say that women are not responsible for that. The structures of our social system, patriarchy, where women is considered as a secondary sex, and even her income is considered as a supplementary income to the family. So, these are the notions which are there, which become more stark. And unfortunately, we don't have the accounts, the sociological accounts and feminist epistemologies or empiricism of Spanish flu or the earlier pandemics, which can throw light on such kind of exigencies from where we can pick up cue and kind of think of the policies. Now, the worry of UN has also UN has also pointed out this worry. They are worried that the increase in violence for which they have worked for so many years should not get institutionalized. So what should be the policy? UN Women wants to come out with the policy which is more gender friendly and which they want to ensure that this pandemic does not have a gendered implications. It has a gendered impact. How to neutralize this impact so that these are not long-term impacts and they go away with pandemics. Now, very interestingly, COVID has brought forth again the same reality that women are victims and men are perpetrators. Where is the agency of women? Though her agency is very important, we need to recognize her agency, because if we see, women are the managers of crises. The crises are being managed by women, but still that acknowledgement, that recognition is missing, and women are becoming victims of fear and atrocities in household. The site of violence is becoming household, and that is very much worrying, because we are not going to offices. Now the site of violence at home has to be addressed. The normalization of unpaid work and underpaid work has to be questioned. That has to be set straight. Ineffective laws, patriarchal structures, masculine policies and practices in our society have to be relooked and reviewed, because we had certain solace when we saw in pre-pandemic situation women going out, claiming space in public domain. So we felt, oh, change. And now suddenly we are again brought forth a stark reality where we see that given if there is some crisis in this situation in society, then again women would slip back to that situation. And how do we share the responsibilities? How do we, gender sensitization has to now address the question of pandemic. Gender sensitization was addressing the question of gender sensitization during normal times. Now gender sensitization demands that how do we address and how do we emphasize on sharing of responsibilities. That is very important. Sharing of responsibilities, because site of violence is household. I would again focus on that, and how these consumers of their labor become their oppressors is very important question. The care labor which is consumed by the family, and yet women are exposed to malnutrition, violence, is very important question. Why then they are it? Because they are giving much. They are working. The ILO says that on average, urban women works more than 370 minutes in India, and a rural woman works 297 minutes in India, whereas men work give only 20. This is, I am talking about their domestic minus their other responsibilities, whereas men give only 29 minutes to domestic chores. So you see the vast difference in the hours spent in doing work is also very important. So this appropriate burden of unpaid care on women of the household brings in two very important things that I have already talked about, that domestic violence and underrepresentation of their work in market. So the recognition, the value to the care work has to be very important, and this debate is long pending, that how do we do include the income of domestic worker, but we do not include the labor of care which is delivered by a housewife or a mother in the household. And this brings me to a seminal work of Anne Oakley, where she has talked about monotony of housewifeization, and also Marx, where he talks about that women are very important force in society, because what they do in society is that they are the sharp observers of the stress of labor. I mean, they are men who go back regenerated and refreshed to the market, to the work next day. So, these are very important, and at what cost that labor of love comes is also a very important question. So, high time, because no society is going to be considered developed society unless and until, we take care of women. Though Aristotle has also talked about women as a mutilated male, and he also says that, women are mutilated males, and no society can be happy society unless and until the women of that society are happy. So friends, these are very important questions, that where do we need to change? We need to change the very important focus. The locus of change is not only legal sphere, legislation, it is also socio-cultural sphere, where, when the moment we, the conditioning, what we do is that we have seen that inequalities increase, and why women also gladly accept these inequalities is because they want to provide happiness to all. Now, this criteria of providing happiness and to provide continuous happiness to all comes at a cost. It comes at a cost. The continuous efforts to keep happy demands inflexible hours of work in caregiving. So, we see right from the childhood, we prepare women into those feminine roles and men into more distribution of resources, decision making, where women are conditioned into feminine roles. So that binary has to be corrected. That socialization process has to be addressed, is a very important question. The income inequality during pandemic also has to be addressed differently. And also, the dominant role of men has also to be looked from a very different kind of insight, which is very important. Sorry, there was some.
Hello.
So, this dominant role also of the men is also very important, because which is related to market, which is related to, production. So production and reproduction, whereas women are reproducers of very important, they are cultural reproducers, they are reproducers in terms of progeny, they are reproducers of, they are very important agency of reproduction and socialization. So, so undervaluing the care work, we have to set the things right, and the unpaid, underpaid value of care work has documented and has to be kind of part of arrangement of relationships between individuals, because this insignificance of caregiving roles or insignificance of women's role goes into the arrangement of relationships into the society. And we have to see that this trickling down of these relationships into the society brings in public patriarchy. From domestic patriarchy, we move to public patriarchy, where I want to talk about legal and social cultural frameworks. Now, any deviation of women from social cultural framework is considered illegal, unethical, and is punished. So women get scared by this punishment, and women's agency therefore goes unrepresented in social change and are routinely assessed by their work in servitude and punished for failing in their duties, constantly instilling fear through discrimination and punishment. That serves as a strong political power to keep women under their control. Here, intersectionality of caste and gender is also very important. So, any deviations from social norms are attacked, and it is understood that an investigation is required depending on female-dominated systems within the household and outside the social structures of institutions. So, still we see, when we see the pandemic, what is very important question is the Simon de Beau's classic work, The Second Sex. So, you see that 2 steps forward, 1 step forward, and 2 steps back. So pandemic has brought us to that situation where we see that women's progress was a step forward in these 60, 70 years. But now with this pandemic, they have moved back 2 steps. So they have lost jobs, they have lost that market value, which when I say market value associated with their professional roles. So this, we have to recognize this agency of women. We don't have to recognize her only as a victim. So from victim to agency, because she is the crisis manager. Let me talk to you about conflict, because most of the research is on women in conflict situation. So who is responsible to rebuild state, society, community? It is women who have been very important agencies of rebuilding societies, families in post-conflict situations. So similarly in post-pandemic situation also, and during pandemic also, we see that negotiating the crisis, maintaining the health of the family. When I say health, I'm not only talking about the physical health, the well-being, how to suck the anxiety of the family members. Women naturally feel responsible because they're training during socialization that you are caretakers. You have to take care of the family. So, I also have 2 sons, and, one son is a teenager and he is in 12th standard. So I'm looking at his mood swings and I have to read a lot. That how one has to control that anxiety, especially in pandemic situation. So, I feel burdened with this role because I also feel responsible so that, the family well-being does not suffer. The family happiness does not suffer. So, and how to care for elderly so that there is no requirement for us to go to hospitals to avoid infection. So this agency has been underplayed, has been completely missing. So friends, it's very important when we talk about caregiving, the voices of women, the feminist empiricism is very important, and we should insist that any policy on pandemic should include women's voices, insights from women's everyday experiences, which would help us to at least not completely overcome these situations, but at least negotiate and neutralize the imperatives of pandemic on women's life. Thank you very much. Thank you, I'm done.
Yeah, am I audible?
Yes.
Hello, yeah. Thank you, ma'am. It was such an informative session. We have so many comments. Participants really liked the session. You have included almost all the concerns and issues that women are facing these days, and with some positive suggestion to how we can overcome this after the pandemic situation. So thank you again. We will take the questions after the second lecture is over, if it is okay with you, ma'am.
Fine.
Yeah, okay. Then we would like to move to the second session of the lecture. I request again to Mr. Ankur Goswami to introduce our second speaker, Polly Vacklin ma'am, and she will carry over her lecture with that. Thank you, sir.
Thank you, Pallavi ma'am. Again, I am fortunate to be able to introduce Professor Polly Vacklin, Head Department of Women's Studies, Guwahati University. You'll be happy to know that Professor Vacklin's areas of specialization are gender geography, women's studies, gender and climate change, ecofeminism, and gender-based violence. Professor Vacklin was awarded her PhD by the NEHU, that is North East Hill University, Shillong, for her thesis on gender-related crimes in Greater Guwahati urban area in 2006. There are more than 20 scholars working under her on various issues related to women. Professor Vacklin has published various papers in international and national publications, as well as presented papers in various national and international seminars. She is affiliated to various academic and professional associations as well. She is engaged with organizations and institutions like Uppsala University in Sweden, UGC New Delhi, National Commission for Women, Assam State Commission for Women, Northeast Network, Earth and Us, Aurovilla, IOC, UN Women, etc., for research and academic works. She has presented her research works in the USA, in Sweden, in Singapore, to name a few. She completed research projects on surrogacy, sexual harassment of women at workplace, socio-cultural, political, and economic status of women of Northeast India, and water conservation and menstrual hygiene management amongst female students of Assam. At present, she is engaged with a collaborative international research project as a research consultant with UN Women, Unilever and MacLeod Russell on prevention of violence against women and girls program in Assam in the tea estates of Assam. She is engaged as a mentor for the Assam Care Program of Government of Assam during the COVID-19 pandemic. She was awarded the Gender, Place and Culture Award in 2009 for New and Emerging Scholars by Gender, Place and Culture, a journal of feminist geography by Routledge, Taylor and Francis Group. It needs no mention how immensely privileged we feel to have Professor Vecklin today amongst us, and I'm most respectfully requesting ma'am to kindly deliver her lecture. She'll be speaking on education and gender during the pandemic. Ma'am, please.
Thank you so much to the organizing committee for giving me this privilege to talk in this a very broad webinar, because I could see that there are more than 400 participants participating in this webinar, which is indeed a very large number, because with COVID pandemic, we are having another pandemic, that is the webinar pandemic, maybe. And with this huge number of pandemics, webinars happening, to have such a large number of participants, it's really nice to see it. So today, basically, I'll be talking about the education part. Initially, I thought I would speak about gender, what are the gender issues that has emerged during this period, during this COVID-19 pandemic period. But it's good in one way that I didn't touch this point, because the previous speakers has touched almost all the points which are affecting women in a different way and how it is gendered in nature. So basically in my today's presentation or today's discussion, I'll be talking about the education sector. And because almost everywhere we are going for an online, type of learning. So what is it like? What's happening? So today I'll be talking about that. Like how is education affected, and what are the issues and challenges related to education, and how we can move forward. And this is basically, this will be basically my area of discussion today. Let me have my slides on. Okay, I think you can see my slides.
Yes, ma'am.
Yeah.
Sorry to interrupt you, ma'am.
Yeah.
Some sound is echoing near. Is there any other
Should I put on my microphone? Yes, there is a construction going on, and this is another problem of this pandemic.
Okay.
And this is also a problem of working from home.
Yeah. Okay, thank you, ma'am. You are not audible, ma'am.
Hello, ma'am.
Hello?
Yeah, it's okay now.
But the sound is going on at the backdrop. Maybe I'll try to make my voice louder, because the speaker has some problem and I don't want to be delayed with fixing it up and all. So basically I'll be talking today. Is the slide visible or wait, I'll just fix it up once again.
It's visible. It's visible.
Wait, one second. Okay. So today I'll be talking about gender and education issues and challenges during pandemic. So if we look at gender and education, there are some existing, right. Okay. So there are basically some existing, if we look at the present scenario, we find that there were certain gaps which already existed before the pandemic, both in the case of India and also in the case of Assam. Now, if we look at the literacy rate of India and Assam, then if we take the recent census reports, and you'll find that there was always a gap between male and female in terms of total education, to total rate of literacy between male and female, rural and urban. So in the rural area, there happen to be more gaps in case of, and when we compare it with that of the urban areas. Again, when we look in terms of Assam, the gap is more or less, it's better than the Indian scenario. In Assam, if we look at the gap between male and female, it is 11%. So there was always a gap. There was always a gap, gap in terms of literacy rate, in terms of gender. The male and female gap was always there. It has shrunk, no doubt. In case of Assam, if we can compare the literacy gap from that of 2001 and 2011, it has shrunk from 16 to 11%, but the gap always existed. Now, if we look during the pandemic period, we find that how are the students affected during the COVID period? And before I start, I would like to say that this is not a very, I haven't gone to the field. These data are collected totally from secondary sources. And these data are collected from the different webinars and which has taken place and different reports which was published during the COVID period. So these data are totally secondary data. And based on the secondary data, I'll be highlighting the issue of COVID and education and try to relate it with gender. So the students affected during COVID period, we see that a majority of the countries, like during the COVID period, almost all countries, till date, there are 221 countries which are affected by COVID. So a majority of the countries have, almost 221 countries have closed their school temporarily right at this moment. So none of the schools are, in certain ways, certain schools have been open, but not in a major way, but none of the schools are open right at this moment. So almost all the schools are temporarily closed across the globe during the COVID period. And because of this closure of this school, it has impacted 91% of the students worldwide. So 91% of the school are worldwide affected during this COVID period. Again, around 1.54 billion children and young people are affected during the COVID period. I think there is someone using a whiteboard and it is getting scribbled here.
Okay.
Yeah, somebody is using the whiteboard maybe simultaneously, so it is getting scribbled here. So around 1.54 billion children and young children are affected in today's time. Like it might have increased because it is a data which was collected last month. So it might have gone up. And never before, anywhere in the globe, so many children were out of school at the same time. So like if we look at today's period, we find that never before so many children were out of school at the same time, like it has been affected now. Now, this is a global scenario. Now, when we see in the context of India, we find that 300 million school children are affected during COVID period, and of which 1.4 million in higher education, 11,000 colleges are affected. And if we look at, if we have a very broader understanding about what type of schools we have in India, like we do not have much of private or semi-government. 70% of the schools are run by government bodies. And as we all know that across the, except few states, the condition of government schools are not as par with the private school. So during this pandemic period, the 70% of the schools across India are affected more because they're run by government bodies. Now, this has already been touched, but I'll just like to speak broadly about it, like how livelihood and education, how the livelihood, education has a gender implication during COVID period. Now, during the COVID period, we see that the lower economic group, basically girl child belonging to the lower economic group are affected more. Girls' education may take a backseat. This is what the study says, that after or like we don't know when this pandemic is coming to an end, but if this prolongs, and it is, we see that it is prolonging, and in certain state it might have gone up again, there is a spike. So it is going to be a continuous process. And as per the different reports, it is said that this COVID is going to stay here for a longer period of time. So and this COVID is affecting the girl child education who belong to the lower economic group are having a harder time. So girl child's education in the long run may take a backseat. And if it takes a backseat, it is we expect there'll be increase in girls dropouts. So there is like the dropout of girl child will increase because of this COVID period, because it is they who will be affected. And be, through my involvement with different type of NGOs, we got different reports, and also the UN report says that there will be increase in girl child marriages, and child marriages is going to go up. So we've through my involvement with different NGOs, we came to know, and when we interacted with those students, with those girl child, we came to know that some of the parents are already negotiating about the marriages. So they're just waiting for the pandemic to get over. Once the pandemic gets over, then they're just intending to get their child married off. Somebody is still using the whiteboard. Can you just stop doing it, because it is scribbling the whiteboard and it might interrupt? Or can the organizer look into this, please?
We are clueless, ma'am. Who may be doing this?
Yeah, somebody.
Please take care of this thing. Who is doing this?
Yeah, because
it's disturbing the presentation. Please look into your means what the system is going on. Please, participants, look into this one.
Because otherwise it will affect those people who are sincerely want to be a part of this webinar.
Exactly, ma'am. So you carry on. We are trying to do it.
Yeah. Okay. So I think it might be a small kid with some mother who is trying to play tricks with the board or something like that, because it doesn't look like a matured person work. It might be a small child who is fiddling with the maybe the device or whatever. Yeah. So we'll just ignore and we'll start. Okay. So girl child of the migrant workers are affected more. I think the previous speaker also spoke about it, that the migrant families are affected more. And of the migrant workers, the girl child of the migrant family are affected more. And it is said that the report says that girl child's education will affect more during the migration, and also because why the lower economic group are affected, because as we have seen in India, migration happened in a very massive way because of this unplanned lockdown, which was called. Just few 1 or 2 days was given, and the people had to migrate. So a sense of fear, a sense of uncertainty which gripped them, people started migrating, for which and now it is the study, it has been found out that a girl child education will suffer more during the migration, because of the migration which has taken place. Why it is going to affect more? Because migration, when the migration takes place, the migrant always prefer to go to a better place. So when they want to go to a better place, now they have come from that better place to the place of origin, where is always there is always a difference of development between the two. So when they come back to their place of origin from where they have migrated, where the condition is not proper, uh, so they will definitely have lesser access to education in the place of origin. So there, the better benefit will automatically go to the boy child, because we live in a very patriarchal society. And that is why it is said that girl child education will be affected more, uh, uh, will be affected more because of migration. And again, problems will increase during and after COVID-19. And girl child will become more vulnerable during such situation, which has already been stated by the previous speaker. And how they will become more vulnerable, or why they are becoming vulnerable, is that migration, like if you look at when did COVID start, we saw that it started in the month of March in certain states, and in the later part of March. And if we look at later part of March, it was just maybe 2 or 3 months from the start of a session. So migration happened during the mid session of the education institute of across the country. In certain state, it happened towards the in the later part. But in most of the schools, like this lockdown happened in the later stage. So when the lockdown happened, since the lockdown happened in the mid session, so it will affect the children more. So it will lead to more dropouts of girl child. And since it happened in the mid session, and we know we live in a country where the preference of boy child is more than a girl child, be it anywhere. It might be education, it might be job, it might be any social factors. And because of the existing position of the girl child, uh, it will lead to more dropout of the girl child in the education sector. As I have stated, that when they have now they have come back to their place of origin, and they'll have lesser amount of schools in their place of origin, for which there'll be higher dropouts. Again, the quality will fall, because if they have migrated from Delhi to Bihar, so schools in Delhi were better than Bihar. So quality of the education in a rural area of Bihar will not be as par with the quality of education in Delhi if they have migrated from any urban area. And it is seen that since migration and how the migrant family will be affected, the quality of the girl child will be kept at home. So now recently there is a notification that the informal schools need to be open. And when the informal schools will be open, first it is the boy who will go back to the school, and then the girl. And if it happens for a prolonged period of time, it is assumed that many of the girl child will be married off. And as we know that the migrants were engaged in unpaid jobs, or engaged in, and this girl child will be engaged with unpaid jobs. And at the same time, domestic violence has increased and will increase more. So these are the different issues which are already been discussed by the previous speaker. So I'll not repeat it. I'll go to the other slides where some additional information will be provided to you. So we see that due to migration, like it has not only affected, like along with education, the livelihood is affected, the education is affected, and there is a variation on the basis of gender. Like, and if we look at what is the variation, we find that it is the people belonging to the lower economic group across the country are affected more. And when we look at this lower economic group, it is the girl child who are affected more, and they are not just affected, they'll be affected more in the years to come or in the days to come. And it will have a longer impact because of the existing lower position of women in the society. So this is what the UN says, that till now across the globe 74 crores girls will be affected, and of which 11 crore will be affected in the least developed countries. So in the least developed countries, they'll be affected more. Like of this 74 crores, the girl child belonging to the least developed countries will be affected more. Now in India, even though we do not fall into this category of developed countries, we are considered to be a developing countries, but within these developing countries, we have huge mass of population who still lives below the poverty line or still belong to the lower economic group. So girl child belonging to the education of the girl child belonging to the lower economic group will be affected more. Now, if there is a dropout, it could threaten the right to education, because according to the Constitution, every children up to the age of 14 have a right to education. So that will be threatened, and it will further entrench the gender gaps in education. As I have, when I started my presentation, I already mentioned that gender gap, there is already a gender gap in terms of literacy rate in India, and this is going to further increase the gender gaps in the education system of India, and this will lead to increased risks of sexual exploitation. So sexual exploitation will be increased. So sexual exploitation and also violence, different forms of violence are going to increase. As per certain reports, trafficking has already increased. And when we look in the context of Assam, there is an increasing trend of number of traffic happening in Assam during the flood period, because they are already vulnerable, and flood plus COVID has intensified the number of trafficking happening in the state. So along with different form of violence, sexual exploitation is going to increase, not only in the public places or outside the home, but also inside the home, because many children are exposed to child abuses. So these abuses are going to increase. Again, another impact because of the dropout is early pregnancy. Early pregnancy will lead to early and forced marriages. So these are certain threats which we can see. These are certain type of negativity which we can forecast because of the COVID. Now, from the time the COVID has started, one buzzword which has come in very rapidly is the online classes, the virtual classes. So with online classes, another factors are related with it is the digital scenario. What is the digital infrastructure of India? So if we look at the present digital scenario of India, we find that India is the second largest online market in the world, ranked only behind China. So behind, India is the first one. China is the first one who has a large online market, and India comes second. So in terms of that, we are in a better position than many other countries across the globe, because we already have a strong online market. And the internet penetration rate in country stood at around 50% in 2020. So the internet connectivity, internet laying out of the cables, laying out of the infrastructure, or making the infrastructure available has happened up to 50% in 2020. And we see that there is a strong, there has been a consistent increase in the internet accessibility compared to just 5 years ago. Like, we see that there is an increase in the increase in the internet accessibility in India in the last few years. So there is a 15% rise in the increase of internet accessibility in India. So these are the brighter side, these are the positive sides of the digital scenario of India. We find that there is a increase in online. We already have a setup. Can I request whoever is doing it to please stop it? Whatever you are doing, it's a nuisance for any type of, because it doesn't seem, it is done deliberately. It looks as though it is done deliberately. Please stop it. This is not fun. This is not fun to disturb invited or anybody, when the rest of the rest of the participants are willing to listen. Whoever is doing this nonsense, please stop it. It is very disturbing.
Dear
This
participants,
is no fun.
please stop this. Dear participants, please cooperate us.
I think, yeah, Rinku, please be very strict, because if it is creating a lot of disturbance to this.
Yeah, you can't concentrate.
Yeah.
You can't concentrate
we cannot,
like this.
Yeah, we are really sorry, ma'am. We cannot identify the
Don't
person
be sorry.
actually.
Whoever is there, he's listening or she is listening. So this is not fun.
So just go off your whiteboard, whosoever it is. Go off your whiteboard.
Yeah, please go off your whiteboard. Don't experiment when the presentation is going on. Do it afterwards.
Maybe someone has given the mobile to their kids or left it like that.
Yeah, exactly. That may be.
Yeah, because
And
I'm not being able to concentrate. Rinku, please don't be guilty about it. Don't feel sorry about it.
No. It's
Because
okay, ma'am. But actually, we cannot identify the person also.
You know, actually,
Who
this
is doing
is what is the very bad side of webinars. People
Exactly,
register,
ma'am.
people log in, and then they sleep. So this
is the problem, because all are listening so carefully. Why someone is disturbing like this?
And when something pops up in the screen, it's very difficult to concentrate, because we have to, it's not easy. Taking a lecture is easy, but talking in a webinar is very difficult, because there are lots of resistance which come in. We are talking in front of the screen, but I'm feeling sorry for the rest of the 409 participants who are concerned. I'm not being able to do what I want to do. I'm not being able to give my lecture the way I want, because there's so many things coming in the screen. Okay, let me just...
Dikshita, you may follow the suggestions given in the chat. You need to go to the settings and stop whiteboard. Please try if it is possible.
I think that will be.
Yeah, it's very difficult to concentrate, because I'm not being able to do justice to the rest of the participant who is here. And this is not fun. And we live in a country like this, and how can we be progressive? That's really sad.
Yeah.
Okay.
Ma'am, you please carry on.
Yeah. I'll do that. So if
Yeah,
we look at the present scenario of a digital scenario, we are in a far more better place because we already have the infrastructure laid down to a great extent, and there is an increasing trend. And in the last 5 years, there is an increase of 5%, 25% increase in the network connectivity across the country. But there are certain problems also in relation to that. Now, if we look at the internet users in India, now please ignore the other scribbles and all, and the arrows also. If you look at from 2015 to 2000, these are the two estimated rates. If we look from 2015 to 2020, there is a huge increase in the users, number of internet users. There is a huge increase, and these are in millions. So these are in millions. So from 2015 till 2020, in 2015, there was 259.88 million people who are using internet. And in 2020, it has increased to 445.68 million increase of the users. And it is expected to grow up more. So the number of internet user in India is increasing, which is a good sign. Now, when we compare between the urban and rural internet or rural use of internet, this is also a very promising site for India. In 2009, the lighter color, it indicates the rural area, and the darker color indicates the urban area. Okay, so in 2009, the number of internet user in the rural area was lesser. Now, in 2018, almost same, like internet users in rural and urban area, it has increased. So the internet users in urban area is also increasing, and the internet user in the rural area is also increasing. Those blocks which are on top, it indicates the rural area, and the darker green indicates the urban area. So there is an increase in the internet use in the from 2009 onwards, and there is a rapid increase. If you see the size of this light green color, you will find that there is a larger increase, like it is increasing rapidly. And if you look at urban area, there is a constant increase. This is a constant increase, and this is because this curve, if we draw a curve around here, we see that this curve is sharper. So internet users in India, in rural area, is increasing faster than the urban areas, which is indeed a very, it is indeed a very positive sign for in country like India. And this is, again, I've collected this data from a secondary source. Now, if we compare internet users on the basis of gender, this is very interesting. Now, between this lighter blue indicates female and the darker blue indicates male. Now, lighter blue, if we look at in 13-17, in the age group 13 and 17, it is girl child or female, they use more internet. Between the age 13 to 17, more girl uses internet than boys. Whereas from the age of 18 to 34, there's a huge jump. Like 15% of the girl child of women between the age 18 to 24 uses internet. But there is a difference between male and female. So more male from the age of 18 to 34 uses internet between this age group, whereas there is lesser female using internet in this age group. Again, and but again from 34 to 64 years, more female users than male. I don't know why it is so. Maybe we need to do a more serious study on that. If we observe the trend, then we find that it doesn't show a very strong pattern, like it is the more male uses internet and lesser female uses internet, it differs according to the age. But again, this is something, it shows, like if you look at this data, we find that it shows a very interesting characteristic. Interesting characteristic because this is the productive age, 18 to 34. It is the productive age where they are into different jobs or when they are educating themselves. And here, male have more access to internet than the female. Whereas with the progress of age, it is the female who uses more of internet for different purposes than the male child. So we do not see that, it doesn't show, it's very interesting because it doesn't show that male are using more internet than the female, but it differs according to the age. Now, but even though this is the scenario of the internet, but when we look at the issues and concerns related to network or related to online or internet connectivity, there are certain issues and concerns. First is that the physical infrastructure of internet connectivity is already been laid out, which I said in my previous slide that there is an increasing trend of laying out of internet connectivity across the country. There is an increase of 25% from in the last 5 years, and there is a 50% increase from the time we started having internet. And so the physical infrastructure has already been laid out, but the problems are there are huge amount of challenges, and that's why we hear students having lots of protests and also teachers coming and cooperating with them, like about the evaluation system. Now the case is in the Supreme Court's hand to give the verdict, like should we have how should we evaluate our students from school to a master's degree, how are we going to evaluate? So because of these challenges, the challenges are, the first challenge is inadequate electricity connectivity. Now, if we look at the power connectivity, we find that the data said that 99.9% of homes across India have network connectivity. But if we compare the hours of power connectivity that the households are having availability of it, there are disparities. First of all, for example, 16% of India's household receive 1 to 8 hours of electricity daily. So 16% of the household, they receive maybe 1 to 8 hours. So they, again, 33% receive 9 to 12 hours. Only 47% of the household, of 99.9% of the household in India, receives more than 12 hours of electricity daily. So this is a challenge because one may have internet connectivity, but if there is no electricity, then how it's going to work? So this is another problem. Next is internet connectivity. Now, internet connectivity, as I have already spoken up in details. Now, lack of devices, like when I say devices, it might be computer, it might be laptop, it might be smartphone, or any form of electronic or digital devices. So there is the internet connectivity may be there, the electricity may be there, but they may not have the device. So when we compare devices, we find that 24% of India owns a smartphone, and only 11% of the household possesses any type of computer. So only like 24% of the entire population of India have one or two smartphone in their family, or at least have one smartphone in the family, and only 14% of the household possesses any type of computer. So there is a lack of devices at home. And when we talk of digital literacy, this is another issue. Inadequate digital infrastructure is another issue. It's another challenge. And as a whole, the study says, one of the reports says that 24% of Indian households have internet facility. So only 24% of the household have internet connectivity and internet facility. So just having connectivity will not do, but at the same time, internet facilities are also essential. Then other issues and concern is that As we know that 66% of of Indian population live in villages, out of which 15% of the rural household have access to internet services. So the connectivity may be there, but they may not have internet services. So only 15% of rural household have access to internet services. And there is a difference between urban and rural, whereas urban household have 42% of internet connectivity or internet services in their household. Now, 8% of all household have members aged between 5 to 24 years have both a computer and internet connectivity. So if we see only 8% of the entire population of India has both a computer and an internet connectivity. But again, there is a problem related with it, is that not necessarily imply that the connection and devices are owned by the household. So they may have a computer, they may have internet connectivity, 8% of the population may have internet as well as the connectivity, but they may not be an owner of that device. Again, there is a differences on the basis of state, on the basis of connectivity, electricity, digital infrastructure. And if we see it, we find, and when we look at it in the context of Assam, 20% of the household in Assam have internet or have internet connectivity in the state. Again, there is a gender gap in relation to access of internet. That is, they did a total out of it. Like here, when we find the total from, if we do not look it on the basis of age gap, we find that 67 men have access to internet, whereas 33% of women have access to internet. When we do not try to compare it on the basis of the age group, we see a gender difference. We see that 67% of men have access to internet, and whereas 33% of women have access to internet. And again, there is a difference in terms of use of internet, in terms of gender. In rural area, 72% of men have access to internet and 28% of men have access to internet. This is as per the 2019's data. Now, what are the challenges for the teachers? Now, for many of us, as I was, maybe when I was interacting with you all, I just lost my temper when I saw somebody scribbling on the board. These are the challenges actually. These are challenges for the teachers because large number of teachers have never used an online environment to teach. So teachers were always used to having a physical class, not a virtual class, an actual class. Teachers always, most of the teachers availed the conventional way of teaching. So suddenly when this online classes has come up, many of us are not used to online environment. So this is another challenge which has come up during the COVID period. Again, at the same time, designing a lesson plan and preparing teaching materials such as audio visual contents are new challenges. So sometimes, as for example, it's good that this has come up so that we can use it an example. We know how to use Zoom, but we do not know how to use the whiteboard. If somebody is using the whiteboard, we don't know how to stop them. So these acts as a barrier. So maybe this is a very simple barrier, but if it's some large, if somebody is having a very serious type of work, and these barriers are coming up because we do not have a complete knowledge about the system. We do not have a complete knowledge about the mechanisms that we are putting into use. Thereby, these are the challenges which we face. Again, not all students, teacher have a quiet space for learning and teaching at home. Now, if we in today's context, when I started my session, I was asked by one of the organizers to like if I can put the headphone, but the headphone was not working. So I thought that, okay, let me say a bit louder, because you may not find a quiet space, because schools, the quiet space is created. But in a virtual world, it's not possible to have a quiet space. Even though I'm sitting in one room, I have that I have that provision. So I'm blessed with that provision of having one room for this class. But think about the other peoples in the society where one room have to be shared by maybe 7 or 8 members. So it becomes a huge challenge, both for learning and teaching in such situation. At the same time, there is a cost implication, because those of you who are attending this webinar, you are doing it in terms of certain cost. What is that cost? Your internet connectivity. So when I was taking classes for my students, like, we made sure that we will not have more than 3 hours of class, because many times the students run out of the data. So in between, maybe after the end of the session, or sometime every day, they have to get their data card recharged, because, and there is a cost implication there. So cost implication also comes up in terms of online education or online learning. Then work from home is more taxing and stressful for women and girl child, because of the increase in the productivity role, which the previous speakers already talked about it, because we live in a patriarchal society where the reproductive care work is the duty and responsibility of the female in the household. So when girls are at home, and when the female teachers or female workers are working at home, we have to adjust our timing according to the reproductive role that we have. For me, nowadays, I felt that the previous days were better, where I can just focus on my office work during the office period. But now it just crosses over till 1 till 2, we need to work, because in between we have to exhaust our household works. And because you know how things are happening now, you cannot have a maid, or you cannot have a domestic worker to help you out. So along with the reproductive role, when you are doing your productive role as an employer, as an employee, it becomes very difficult, because of their productive role, which has increased manyfold for the women in the household, because we live in a patriarchal setup where it's not possible. In a patriarchal setup, it's not possible to change the habits. What were the habits? For example, in a patriarchal setup, uh, in a traditional Indian family, men usually do not do the household work, and which has been going on for so many years. How do you expect them to change within a period of maybe 3 or 4 months? It's not possible. So the burden falls on the girl, burden falls on the women and the girl child at home, and uh, and thereby it affects their productivity, and that productivity of the person gets affected, and also the time which they need to devote for the works gets hampered. So these are the challenges for the teachers as well as for the students. Now, how to mitigate, how to come off from it? It is suggested that these are the suggestions which I have taken from different reputed and renowned organization, and also which like through different suggestion which is given by renowned policymakers, or social activists, or educationists, or researcher. One suggestion which I found it very interesting was that government provided one-time digital device during starting of academic session. So when an academic starts in exam, like those, when anybody secures more than 60% in the class 10 examination, they are provided with a laptop, and that is working very well now. So those students who did well in the class 10 exam and have a digital device at home, they are benefited by the scheme which was adopted in Assam previously. So now, instead of class 10, if a digital devices is given to us at the starting of the academic session, then this is going to help in mitigating the COVID situation. Now, another thing which really struck me is that when 200 lakh crore was announced by the education minister a few months back in through that Atmanirbhar Bharat Abhiyan, there was no money, there was spending of, there was no fund for education, which is really something to worry about. So there should be more fund for education. Again, telecom operators and broadband service providers should offer facilities like additional data and free internet to the student subscriber. So if that is done, and if it is pushed by the government to make it in a form of a policy, students will be highly benefited. Again, even though the network connectivity is being laid out, there are different gray areas. Maybe there are technical, which creates technical glitch. For example, cable floods, poor connectivity, signal issue. These needs to be worked out because we don't know for how long this is going to go. And technology should also be used for tracking and tracing the girl child, because as the organizer has read it out, that when I was working with Assam Care, almost all the states across India, they have noted down the information of all the migrants that wanted to come back. They provided some sort of fund, this provided some sort of relief to them, monetary relief or other services relief also. So now almost all the states have the data of the migrants working outside. So through this data, the girl child can, these families can be traced, and the girl child can be traced, and they can be brought back to school. And also at this time, integration of works between the ASHA workers and the Anganwadi workers are very important, because the ASHA workers are healthcare providers, and the Anganwadi workers are education care providers. So there should be an integration between the two, which will lessen the gap, or it will help us to mitigate the situation of the COVID. Now, again, uh, like what these are my opinion on the basis of what I have gone through. Like there should be some very strong avian based on education. Like if government would look for possible quarantine facility, because suddenly number of quarantine facilities got constructed. If we can think about quarantine facility, because we had an aggressive attitude to government used some aggressive approach to form this quarantine facility, then why not for education? There should be some abhiyan like school chalo abhiyan, digital abhiyan. So go digital, go to school. So these type of abhiyan will definitely change or definitely help us to mitigate the situation. And at the same time, it is really something to worry about, is that even though when everything is going digital, and digital education is given huge emphasis in national education policy, but there was a cut uh, from 604 crore of like they have reduced the fund from 604, they have reduced to 469 crores, which was there allocated for digital infrastructure improvement in remote learning. That has gone down, it has reduced, but whereas it should be increased. The expenditure on digital infrastructure should be increased, not reduced, which is being done by the present government. So every problem and issue should be through education. So if education is given importance, if problems are sorted through education, when I'm saying education, I mean education from top to bottom, from research, if any form of work, if any form of initiative are done through education, it will bring in huge change. For example, education for climate change, education for skill development, education for digital learning, and education for enhancing the quality. So if it happens through education, it will definitely provide some sort of changes in the coming years. And initiative and how to bring back the girl child is like nowadays in Anganwadi, at the present scenario or before COVID, one meal was served, but if 2 meals are served for girl child, it will bring back the girl child to the school. Incentivize the parents. It will help to, like, some sort of incentives should be provided to the children so that they continue to send their girl child to school. Skill development is important. If skills are developed for the girl child and women, their employability skill will increase. It will enhance their development skill through the skill development, and thereby the employability is also going to increase. Again, the previous speaker has also said that we should focus on the informal and unorganized sector, because as per the study goes, it says that around 80% of women are engaged in the unorganized sector. So if these unorganized sectors are looked upon, it will bridge the rural and urban areas in a better way. And government has now information of the workers of the people working in, both women and men working in the informal and unorganized sector. So they could use it for different policy making, because they have the data now and they can use it for some developmental works. Now, how the world is coping up. Now, if we look, then different countries have used different coping mechanism in terms of education during the COVID period. Now, Ukraine happened to be one of the first country to provide a device. It was an online curriculum, which is known as Learning Passport. It was designed with the help of UNICEF and Microsoft, and they have come up with a learning passport. It is known as learning passport, through which the online curriculum was, or online learning or online education was imparted to the students during the COVID period. Rwanda has used radio. Timor has used online books and videos. Syria, now Syria is a country which has already, like even before COVID, millions of schools were out of schools. Schools were stopped. So that is now 2020 is the 10th year of children not going to school. So Syria was already teaching the school children through online process, and self-learning program works. So Syria has already was into online mode of education. And again, not Macedonia, they have TV classrooms, which involves voluntary teachers, and they deliver classes, and they present a wide range of activities to the students, and they were involved in the learning process like TV classrooms. In Vietnam, they have online and offline learning materials, including physical exercises. So it was provided both online and offline. Then Costa d'Ivoire, they have taping lessons to be aired on national TV. So they have, they record everything and they air it in the national television, which government of Assam also started doing it. In Latin America and Caribbean, they provided fun new activity every day, and they provided learning at home initiative. So they provide different type of activities, not just not studies, but fun activities, exercises, where parents can also adopt with what is what is provided to them, and it is also shared with the parents. So the parents are also involved in the learning process. So this is how the world is coping. And if we look at this list of countries that I put in here, I think the position of India is far better than all of these countries here. So if they can, why not us? So these are the different pictures which I have put in here, and this I've collected it from UN reports. These are the different modes which are used. This is in Ivory Coast. This is in Ivory Coast. This is in Vietnam. This is in Macedonia. This is in Syria. This is in Ukraine. And the last is in Rwanda. And I like this one very much. Like the radio is also broken. And with the broken radio, they are, the child is so engrossed with the education system. So with that, I finished. And now I'm ready for question and answer sessions. Thank you.
Thank you so much, ma'am. This is really an informative lecture. We have all the data you have collected so seriously in all the big area of discussion. And we will be taking the questions now. Arvinda Ansari ma'am is also waiting to take the questions. So I think we should start with ma'am. Is it okay, ma'am?
Yeah, of course. So, others, as the question comes, we can just.
Yeah, sure. Yeah. Answering, ma'am.
Yeah, please.
Yeah, you have lot many comments actually, more than questions. But first, I would like to come to the questions. Your lecture means participants liked your lecture like anything. Madhurima Dasgupta, she has a question. First, has domestic abuse increased against men too during lockdown? There are reports of increasing domestic abuse against women during lockdown. But what about men?
Look, in a way, pandemic has affected both men and women because men have also lost jobs. Men have also, faced this kind of situation where they are completely locked in homes and their productivity has been questioned. So that change has been there. But when we talk about domestic violence, which has increased many-fold against women, there is a documentation for that. Men, I would say, have not been that way we can say that the victims of domestic violence. Now we need to understand that what is this domestic violence. But yes, they have faced a different kind of marginalization because they lost jobs. With losing jobs, they became victims of poverty, unemployment, and other catastrophes which we had seen, especially migrant laborers, and then also public violence. There have been a lot of cases of lynching. There have been a lot of cases of stigmatization. So men have faced violence in different ways.
Are you done, ma'am?
Yeah.
Yeah. Can I move to the second question? This is from Padmaja Gogoi. She wants to know, do you think our gender blind policies would worsen the status of women even more?
Yes, that is whole, emphasis of gender sensitization. Why are we talking about gender perspective now? Earlier we used to talk about women, now we talk about gender perspective, which is diverse, which has multi-disciplinarity, which is inclusive. And it is very important that we have a gender perspective on each and every social phenomena. It is very important to understand because I'll refer to pandemic. Otherwise, also, if you see a social situation, we have been talking that there has been policies which have excluded women. So that is why we are talking about gender, and gendered perspective is very important, and it has to be inclusive. So we have to have policies which focus men, women in context of each other. And when we talk about gender, we don't have to forget about transgender and other genders also. They have to be included.
Yeah. Thank you, ma'am. Then one Simran Jolly, she actually, I think, is lady. She tried to catch hold of all the situation of women in village areas, rural areas, but due to lockdown, she could not do it. She wanted to take up a project. And now she is asking how to work in this in particular scenario where without physical contact and focusing less on COVID-related issues, how can I help them rescue their situation?
Look, now this is one very important question which is coming up, that, because of lockdown, there are certain pressures on us. And in fact, if we look at social science research, this has come a very big challenge, that how do we continue with our social science research, where, our understanding is based on field work, which comes from the field insights. And in lockdown, where we cannot do field work, where we cannot go to field, how do we kind of compensate and fill that gap, which is very important. So, we have to now find out new methodologies of dealing with the situations, and maybe this would be documented in future as our quarantine diaries and our quarantine methodologies, where we now, very importantly, I agree with Simran. I think if I'm correct, you can correct me if I've taken her name rightly or wrongly, because Madam Polly had made very clear when she was talking about this digital divide. And this digital divide is existing. You know, even if we see, very interestingly, where we have a working couples, if they have one PC at home, so who gets the priority in using we have not done that kind of researches and see that kind of researches where generally men get priority. And during lockdown, I know that people could not even go and buy their laptops, and they were not also getting it through Amazon or other social sites, because it was not, there was complete lockdown till May. So, you know, there were situations where, you know, they had to struggle for the devices. And that struggle also brought more violence in the family, more contestation for the resources. So the whole gender studies has been talking about the contestation for sharing resources, devices. So we have to find out, we have to mitigate this crisis. We have to find out the way we can be a support structure to each other. We have to connect, and to connect for better purposes. Now, for that, one very important is that digitally literate society. Are we digitally literate society is one. Second very important constraint, what the speaker had mentioned, is access to devices. Access to, and have money to get data packs. So these are real-time challenges, and we don't know, we have no clear answers that how are we going to mitigate. It is on our level. You know, one very important significant point which I want to say from this platform is that civil society, it is civil society who has tried to negotiate with the crisis more than the help coming from the state, whether it is dealing with the disease or, you know, dealing with the situations, poor condition of migrant workers, providing them food, slippers. You see, if civil society would not have stepped in, there would have been much more casualties. Everywhere we again, I'm reminded of Durkheim, that collective solidarity has played a very important role. So that we again have to learn this lesson that we have in this globalization, in this era of globalization, that sociability. And how do we keep that sociability alive in this situation of social distancing, which should be called physical distancing? That sociability is very important, and we have to find our individual. There can be no set way of saying that this is sociability, but that connect has to be created. How do we create that connect? We have to find ways and means. I cannot say connect through phone. You have a phone, maybe your respondent does not have a phone. Your respondent cannot fill Google form. So we have to find out new ways, innovative ways, creative ways, where we can at least document. And this documentation of insights is at every level is very important. Men facing violence, yes, it's a very important question. Somebody wrote that the caste and the tribe is missing. Yes, it is missing. I mean, not directly talked in both the presentations, but the intersectionality of caste, religion, tribe is very much when we talk about diversity. It is not that, you know, when we talk about ASHA workers, we see that they belong to certain castes, certain marginalized classes. So that's there. And when there are instances, if I can share it with you, when during that whole Marcus controversy, Muslim women from Muslim community were denied treatment. They were not even allowed to deliver in the hospital. They had to deliver in the van. So, you know, that is what I'm saying. Pandemic has brought out not only economic inequalities, which we were aware of, the public health inequalities have also been highlighted in this pandemic, and we need to seriously think about it, because that is very important question. Yes.
Thank you, ma'am. Another question is from Vikas and him. He is concerned about the transgender. He says that when gender is taken, why only male and female is considered? What about transgender? They also face discrimination. What about your
Yes, they are facing, and they are being moved because they are also taught that loss of their profession, because, you know, they cannot do performances or whatever traditional occupations. When we say gender, we have to be very careful. It has to be inclusive of all genders. Transgenders is a very important category, and they have suffered not only, you know, economically, but socio-culturally also they have suffered. Last night there was a case a transgender, aged transgender has been thrown out from home, wherever he or she was living. So now we have to accommodate. So we, like our group was trying to negotiate and find out a Grand Basera where we could place the transgender. That sensitivity has to be created, very rightly pointed out, and they should be part of our discussions and discourses when we talk about gender. Yes, definitely, I agree.
Yeah, moving to the next question. It is from Pradipta Ranjan Patnaya. He wants to know what, according to you, is at the root of gender discrimination. Is it patriarchy or gender stereotypes? Even COVID-19, which enforced a certain kind of physical proximity between men and women at home, failed to ensure easing out of the multitasking blues of women. So he wants
Look,
to know.
this is very important point, and this is the whole debate is centered around that there have been phases. What I will tell you, during the first few days of lockdown, it was an excursion for middle class. Let me give examples from middle class that they were enjoying company, they were making up for the time where they had not been able to spend much time with each other, children and everything. It was a kind of family holiday. But post 15 days, when economic, social, and other pressures started building up, and there was too much of looking at each other, and there was complete loss of me time for both men and women. For women more, because they didn't have a me time. Their me time was lost in time and space, because when you are working online, so there is no holiday, no sense of weekend, no sense of time, and no sense of space, because it exists in a virtual world. So it was too much of and again, unconsciously or consciously, the extra responsibilities are generally taken by women, and women are trained by nature, to be forthcoming with domestic care and responsibility. So it is, you see, we have childcare leave for women. We don't have for men. Why don't we have it for men? We say that parenting is changing, and we have only childcare. So state also thinks patriarchically that it feels that the basic responsibility of caring and rearing is the responsibility of the woman. So she should get childcare. The man does not need childcare leave because he is absorbed of that duty. His work is, prioritizing the work of the men. The work of the men is directly related to market and growth of capitalism. Whereas still that even if women are getting, forget about wage gap, where women are getting same packages, their incomes in the family and community are considered secondary. They are expected to make changes in their career to keep families together. What, Parsons has talked about instrumental and expressive roles. So mothers play, women, daughters, they play expressive role, emotional roles, keeping emotionally families together. And men play instrumental role. They are responsible for providing, protecting, and connecting their families with the world. So this is working in our minds, and pandemic has proved it, that we maybe, it was lying little low in our minds under the compulsion of two-income families. Where now it is a compulsion in modern day society that we need two incomes. So it was lying down, which has come out again. Given the situation, given the environment that has come back, and this coming back of tensions in the family and violence in the family is also hinting towards that it had not gone. It was just lying low in wherever. I mean, it's not that violence against women has decreased, but it was, and it has erupted back. It has come back with the same force and rigor that is being significantly shown by the reports which are coming.
Thank you so much, ma'am. There may be some more questions, but since we are running short of time, so I would like to move to Polly ma'am.
Thank you very much for giving me this time, and thank you, Polly. It was wonderful listening to you. Thank you, all of you. I need to leave because there is another meeting. Thank you very much. Thank you.
Thank you, ma'am. Thank you so much. Now I hand over to Ankur Goswami, sir, so that you can take care of the questions sent to Polly ma'am.
Thank you, ma'am. I think I'm audible.
Yeah.
Yeah.
This question is to Polly ma'am, and this is from Savita Gautam. She says that the present government has allowed all types of education through digitalizing at this present moment. So, and you have already delved into this issue in detail, that most people do not have access to the digital electronic devices, especially in the rural areas and in the backward areas. But she feels that this is a part of discrimination. Would you agree to that?
Yeah, if everybody do not have an access to it, and if something is imposed, that can be, by definition, we will call it discrimination. And it's not just discrimination, it's also insensitivity.
Okay.
Along with discrimination, of course it is discrimination, because if everybody do not have it and you want somebody to have it, then by definition it's discrimination. Along with discrimination, I would add one more thing, that is insensitivity.
Okay. Another question is from Subhankar Sharma. It is that when education is at stake and that literacy rate disparity among the feminine gender is at a constant rising thing, can community learning or community education have a fruitful role? Because it's a long question. He feels that because the social structure is deeply rooted in patriarchal system, and that the parents are mostly eager to get their daughters married off. Is it helping, like community learning, community education, these sort of things?
Like if we, because in this new education policy, they have added one component. I don't remember the word properly, that women will be given more response. They'll be the role models. So these role models will be female who are achievers, and they will be playing a leading role in the primary education and the school education. It's not for higher education, it's for school education. So for the person who asked this question, this might work out in those areas where existence of community learning is not possible if the patriarchal mindset exists. So there are, even in today's time, there are certain areas where girl child are not sent because there are boys in the school and the educators is a male. So along with community learning, female instructors, sensitive female instructor, if they are provided, it might work, but it also has some sort of it also has some negative impact, so it is, again, you're pushing the girls into one corner, being educated by girl, being I feel I don't think it's a healthy habit. I feel that instead we should make people more gender sensitive, not just gender sensitive, know what is gender. The gender understanding about the society is more important if we really want to lessen the disparity.
Thank you. The name is not given. Another question is COVID-19, and it is about COVID-19 and mental health of working women. How working women should handle this type of situation?
If you ask me, my anxiety, if I'm speaking from my own experience, the anxiety has gone up very high. Like anxiety in the sense, like first was the anxiety of taking virtual classes. It took me 1 week, whole 1 week to probe how to take classes. And next, like maybe for the working people or working women who are working from home, things are happening in a virtual world. So first to learn the apps, next to deliver the lectures through those are anxieties, but it hasn't affected me so seriously, because otherwise I have a peaceful home, but it may not be so. So yes, it is affecting. And what was the later part of the question? Like, is it affecting, and does this
and how to deal with that? How should the working women try to deal with that situation?
I would suggest that what we are doing in a university, we have been asked to, I'll be able to say more from Education Institute perspective, because this is where I'm working. The Ministry of Human Resource, I would say former, because now Education Ministry has come up. So we have been instructed to form mental health task force. From time to time, we have been holding seminars, we have been holding counselings, and this counseling is also helping me out. And I prefer to do those things which makes me happy, even if it's just lying on the bed, even if it's doing nothing, or even if not submitting my work on the deadlines, because everything is abnormal now. I won't say normal, new, we are giving, to make ourselves feel better, we are using new normal, but everything is abnormal. But I prefer to do those things which makes me happy, maybe write a paper. Sometimes writing a paper is also stressful, but do those things which makes you happy. Yeah.
Correct. So there are several questions I would like to ask, whether you have got time to answer, because one is to do with the impact of new education policy on women and their education, which I think is a broad question, requires a lot of time. And one question is referring to the slide on the internet users on the basis of gender you had dealt with. So Dr. Gunanidhi Banik wanted to know how the disadvantaged categories like SC, ST, OBC, their use of internet, could that be found? Can we get a data on the percentage of use of
I think this
internet?
question will answer some of the questions which are there, because I just scrolled through and I found number of questions, and maybe this question will answer few of the things which are down there in the question lines also. Now, knowing about the biggest problem about knowing about women is lack of data. Like, forget about ST, SC, OBC women. We don't even have information about women. Forget about the other genders. We have a very, data are provided, this many people are employed, this many people are working in the primary sector, secondary sector, tertiary sector. We don't even have gender segregated data. And when we say gender segregated data, it indicates as though it is just male and female. Like, if the people who are collecting the data are not sensitive and providing data on the basis of gender, how are we going to provide data? How are we going to provide any information on the basis of gender? And because of that, I think there is a question which is on goal 4, which is about education.
Goal 4, yeah, exactly.
Yeah, goal 4. Just check goal 5, which is gender. All across India, the performance of goal 5 is worst. Only 2 states and 2 union territories are performers. Forget about upfront, and they're performing less than. If you just open the goal 5 map of India, it's all red. The performance is led, and there are a number of indicators to study gender. Of all the indicators, they could choose only few, because there is hardly any data on the basis of gender. So when we talk about gender, we are talking about women, and even of women, we do not have data. Forget about ST, SC, OBC. Forget about the others. Now, when we say others, we consider others means only transgender, but others are not just transgender. There are huge umbrellas of other forms of gender: LGBTIAPQ, L, lesbian, gay, transgender, agender, pangender, intergender, transgender. But when we say others, we mean only the transgender. We don't even have data. How are we expected to do research? How are we going to give you any information about it as academicians? How many research you can do as individuals? We hardly have data. If we do not have data, how will we talk about those people? So I think many questions were asked on goal 4. Forget about equality of education. When you are talking about gender, we hardly have information about women. Forget about ST/SC, OBC women. And then again, third gender, how are we supposed to talk if we don't have any data? So we couldn't talk about transgender because no data are there. People are talking only about women, and women, now I feel that women are considered a privilege of all the marginalized group, because at least we have data about women, but that is also so very less.
Correct, ma'am. Thank you so much. These are serious ways of looking at things.
And I think one question came up of, there are a number of questions related to NEP. national education
Yeah, yes,
policy.
correct.
I'll just give an overview. Maybe it will answer a few of the question at one go.
Okay, sure, ma'am. Sure,
Like, if you have gone through NEP, like what I feel, what we all lack is that we have the document, we have the information, we do not read. Now, if you go through, because I was forced to read because I had to write a report, I have to present a report about women from Guwahati University. And since we were in the process, we got to know that several lakhs of suggestion came. And again, several lakhs of suggestion were not at all incorporated. So that is another problem. Now, when we talk of, so when I got an opportunity and when I was forced to go to that document, I found that there is hardly talk about women. And when we talk about there are lots of emphases on girl child, and that too girl child in schools. And when we talk about girl child in school, they are providing protective gears, like a protective approach is used, not a gender sensitive, not an empowered. An empowered approach is not used in national education policy. Just do a small exercise. Just click girl child and read what is written about girl child. Just click women and read what is written about women. Actually, it is taking us back to 50, 60 years. So this is what is happening in NEP. So NEP, somebody has asked also about digital learning. It has given huge emphasis to digital learning. But what about women? What about gender? What about the women who belongs to different caste? What about women who are marginalized within the women's group? Women doesn't mean few women from the urban centers or mainland women or urban mainland women. Women represents large section of women, which is not at all reflected in national education policy. Let's wait because no suggestion has been taken. I'm making it easier for you, Ankuran.
Oh, thank you so much. Thank you very much. Over to Pallavi, ma'am.
Yeah, thank you, Polly ma'am, for so detailed answers. And thank you, Ankur sir, for handling the session. Now I hand over to Dr. Rinku Bora, head of the Department of Sociology, to give the vote of thanks and for the summing up notes of the entire program. Rinku ma'am.
Thank you, Pallavi ma'am. Am I audible?
Yeah.
Okay. So a warm and graceful afternoon to everyone present here. Respected Director of NEF Group of Colleges, Dr. Zakir Hussain sir. Respected Principal, Dr. Ghanshyam Nath sir. Honorable Resource Person, Professor Arvinder Ansari ma'am, and Professor Polly Bhacklin ma'am. Respected Assistant Director of NEF College, Farhana Ahmed ma'am. The all esteemed faculty members present here and respected participants. Myself, Dr. Rinku Bora, HOD, Department of Sociology, NEF College, and on behalf of organizing team of today's webinar, it's a great honor and privilege to deliver the vote of thanks. It gives me immense pleasure and satisfaction to offer vote of thanks to our Honorable Director, Dr. Zakir Hussain sir, who meticulously supervised and encouraged us at every stage of this educational venture. I would like to convey my vote of thanks to Dr. Ghanshyam Nath, Principal NEF College, for inaugurating this national webinar and for his thought-provoking inaugural speech. Now, I would like to express my sincere thanks to Honorable Resource Person, Professor Arvinder Ansari ma'am, HOD, Department of Sociology, Jamia Millia Islamia University, New Delhi, who has enlightened us through her resourceful academic speech. Ma'am has rightly discussed about caregiving role in pandemic, gender perspective of COVID-19. The way she explained the topic is exemplary. Ma'am clearly explained caregiving role of a man in light of COVID-19. As you know, historically, a man worked actively as caregiver. In this context, ma'am discussed about division of responsibility of a man during this pandemic situation. And she elaborately discussed the role of nurses, ASA workers, etc. as an active caretakers. She also discussed on feminist epistemology. She analyzed the health-related problems of migrant workers, homemakers, etc. during pandemic. One very interesting point that she mentioned is marital rape is increasing during this pandemic. She said that this pandemic has some gendered impact, and according to her, sharing of responsibility is very important means to liberate a man in this pandemic situation. So I really acknowledge, respect the Ansari ma'am for discussing various aspects of caregiving role of a man facing these days and for showing us the real picture of caregiving role of women during pandemic. I also take this opportunity to extend my thanks to Honorable Research Person, Professor Polly Backlin Ma'am, HOD Department of Women's Studies, Guwahati University, who broadly discussed on gender and education issues and challenges during COVID-19 pandemic. As we know, in a patriarchal society, women are mostly worst sufferers, and they are the oppressed majority. Ma'am analyzed the relation of gender and education by highlighting different issues of women affected during COVID-19. She discussed about education and gender in relation to livelihood. Ma'am elaborately discussed on migration of students and its related problems. She viewed that due to this situation, mostly girls are affected more and it has longer impact. In this context, she mentioned that 74 crore girls will be affected more from least developed countries. So ma'am discussed on gender gap in education, sexual exploitation, early pregnancy, early and forced marriages, etc. in more elaborate manner. In context of relation of gender and education, ma'am has clearly analyzed various issues and concerns with some statistical representation and some mitigation measures. I believe this will surely encourage the scholar to conduct various research activities in this field. I'm really thankful to both of the research persons who spared time from their busiest schedule to grace the occasion and sharing their insightful thoughts today. I'm sure that all the participants benefited a lot with your knowledge and presence. I must mention our deep sense of appreciation for Mrs. Farhana Amin ma'am for her valuable advice and assistance in conducting this program. I'm also grateful to Ms. Dikshita Fukon, Assistant Professor, Departmental Environmental Studies, NEP College, for her technical assistance as a host. I would like to express my gratitude to all the members of Faculty of Arts, NEP College, especially to Mr. Ankur Goswami, Assistant Professor, Department of English, and Mr. Origin Misro, Assistant Professor, Department of Mathematics, for their encouragement and support in conducting this webinar. I am short of words for their involvement and their willingness in successful completion of the program. I also extend my thanks to all the participants for their active participation in the entire program. Last but not least, a big thank you each one of you who made this program a successful one. With this warm words, we move to the end of today's webinar. Thank you all.
Thank you so much.
So there is an announcement. We have given feedback link in the chat box. Kindly fill up it and submit the same. You will get an e-certificate within 1 week. Thank you so much.
Yeah, Rinku, I have given my email ID there because some of the participants were asking. So it's in the inbox, chat box, so
Okay,
they can take the email.
Yeah.
Thank you so much, Rinku.
Okay. Yeah, thank you, ma'am.
And to the organizing committee, Ankur and Pallavi, all of you. I could see your face, so I am thanking you all. Thank you so much, the organizing.
Thank you, ma'am. And from all of us, we apologize for all the disturbances that you had to face during your presentation.
Exactly.
Yeah,
it was really an odd
because there was handling mother's device, I think. So this is what it looks like. It was not
exactly. And ma'am, we tried to identify that person also, but we could not. That's why we really apologize for
it's
that.
okay.
This may be our limitation and the learning lesson also for next, if we plan to do anything.
Academic, next academic activities.
Yeah, it's okay. Thank you so much.
Thank you. Thank you very much.
Ma'am?
Thank you. So we are giving the feedback link in the chat box. Please check it and submit the same. However, if anybody have any problem in submission of feedback link, Kindly contact me in my mail. Thank you.
And some participants were also asking for the PPTs. Rinku ma'am?
We'll have to request resource person for
Yeah,
that.
after taking permission from the resource person, we can.
We will share that in the WhatsApp group.
Yeah.
Thank you. I think we can end the program now. Participants are requested to unmute yourself. If you have any problem in submission of feedback link, kindly inform us.
Hello.
Dikshita?
Hello, ma'am.
Yeah, you can, I think, end the program now. I think participants have no any query regarding.
No, someone is trying to share something.
Okay,
Hello,
okay.
ma'am.
Okay.
Hello.
Yeah.
Can we have the email ID of she
Yeah,
said
sorry.
that she has given it the email ID of Polly ma'am. She said that she has given it in the Dropbox, but it's not there in the box. That's why.
Okay, we will provide the email ID in the WhatsApp group. Is it okay?
Hello.
Hello, ma'am.
We will provide the email ID in the WhatsApp group.
Hello.
Okay. Okay. Yeah. Okay, ma'am. Fine. That's completely fine.
Hello.
Thank you.
Okay. Thank
Yeah,
you,
yeah,
ma'am.
yeah.
Hello.
Yeah.
Hello. Yes. Good
Yeah,
evening,
yeah.
Rinku
Yes.
ma'am. Can you
Yeah.
hear me?
Yeah.
Yes, ma'am. Actually, I have submitted the feedback form, but in the certificate, the salutation is partially removed.
Okay,
From
okay. If
Mrs.
you have
It is.
any problem in that, definitely we will work on that. You will have to
Yes, ma'am.
send me
I
the
have
certificate to my
sent
mail.
it to. I have
Okay.
sent it on your mail.
Okay, thank you.
Okay. Thank you, ma'am. Thank you.
Okay,
We can
following
end
ma'am.
the meeting.
Yeah.
We can end the meeting now.
Okay.